Coming up, we'll be discussing the benefits of ketamine infusion therapy and how it can effectively help in the treatment of depression, pain, CPRS, OCD, fibromyalgia, and PTSD, and improve your overall wellness with one of this region's top doctors and ketamine infusion therapy experts, Dr. Stephanie Esposita. Welcome, Dr. Stephanie. It's a pleasure having you on our program today.
Thank you so much for having me.
It's your first time, in fact, on with us. We have a lot to talk about. Now, you are recognized as a top doctor and anesthesiologist in the DMV region, and you have established a reputation for excellence in your specialty, Dr. Stephanie. You recently opened your practice, Virginia Premier Ketamine, located in McLean, Virginia, to provide patients with ketamine therapy in a safe and highly effective manner. I wanted to begin by having you please tell us about the vision for your practice.
So I've been interested in ketamine for quite a while, and when I did the research, I noticed that California, Colorado, Florida, this is a huge practice that people are using right now. And when I looked in this area, there are very, very few practices. And when people ask me about it, people don't even know what ketamine therapy is. So my number one vision, I would say, is to educate the DMV area what it is and the benefits that it has. So another one of my huge things is I've been an educator for about 15 years, and I pride myself on safety. So I really want to make sure that if I cannot be at the clinic, there will be a board-certified physician in the clinic 100% of the time. I will not compromise safety. All the clinics are wonderful, but some of them do have no physicians on site. And to me, I feel I want somebody safe, reliable, that have the airway skills and the IV skills to make the patient safe and comfortable.
Absolutely, and that is so important. And again, that's one of the big reasons we wanted to have you on, because more and more folks are realizing the many benefits that ketamine therapy provides in helping them deal with a number of issues, and which you're going to be getting into here in the next few minutes.
Yes.
But one of the latest advances, in fact, is ketamine therapy. Mm-hmm. And that is something we wanted you to educate the community about as far as what it is, if you could start with that, and then we can go from there.
So ketamine was first involved in veterinary medicine, but in 1969, it was used in humans for anesthesia. 1970, it was FDA approved for the use in the Vietnam War, because for soldiers, it's a very safe drug, and it creates a pain-free environment where they can do procedures, not feel pain, and not feel anxiety. So basically, I've used it throughout my entire practice for anesthesia, and the benefits for anesthesia are obviously wonderful. But over the last, I would say, like maybe 10 years, they realized that if you do low doses, so not anesthesia doses, we call it sub-anesthetic doses, it has wonderful effects for pain, anxiety, and a lot of mental health conditions.
Yes, indeed. And I wanted to follow up by asking you if you could be kind enough, Dr. Stephanie, to elaborate a little bit more about how specifically does ketamine help in the treatment of mental health?
A lot of the depressed brains have nerve connections that are not normal. They've created a negative environment for them to think because of the nerve connections. But the research has shown in ketamine-treated patients that these nerve connections actually repair themselves and become restored. So it's almost like instead of thinking constantly in a negative frame, their mind is thinking differently in a more positive frame.
So
it's called neuroplasticity is what they call it.
Oh, okay. Very interesting indeed. Now, you touched on this a moment ago where you mentioned a couple of conditions, depression being one that ketamine therapy can help folks with. And I wanted to ask you if you could please go into a little bit more detail about that as well, as far as what types of mental health issues does it help folks address?
Right, so it does a lot of things. Depression is the major one. Another one would be fibromyalgia, which fits into two categories, the mental health realm as well as the pain aspect, which is something we could talk about later. Obsessive compulsive disorder, people know it as OCD. Postpartum depression, so after pregnancy, obviously. Another one is post-traumatic stress disorder.
Yeah,
so
PTSD,
again,
yes.
PTSD. And they find in patients that are suicidal, it actually has great benefits for suicidal patients.
Now, who is a good candidate, Dr. Stephanie, for ketamine therapy?
What they've shown is mostly treatment-resistant conditions. So for example, someone that has tried multiple medications like antidepressants, anti-anxiety medications, those that have failed or have had bad side effects, these are great candidates for this therapy. People that have tried therapy or TMS therapy, which is very, very effective for depression, if they have failed, another reason to use ketamine because it is an alternative.
So basically, ketamine therapy is a wonderful alternative, based on what you just said, for folks who tried the more traditional options and they still didn't get the results that they certainly wanted. So ketamine is there to help folks dealing with more extreme conditions of anxiety, depression, OCD, PTSD, for example.
Correct, that's right, yes.
Okay. I wanted to also ask you, Dr. Stephanie, can you describe the process that your patients can expect for this type of therapy, from when they initially contact you, you set up a consult, I would imagine, and then how it goes from there?
Right, so after the consult, which I'd like to involve their psychiatrist or their therapist or their primary care physician, whoever diagnosed them, I make sure they're safe for the therapy, so we go through a whole questionnaire. And then when they come to my clinic, the first thing I do is I review things with them again, make sure nothing's changed. And I do a set of vital signs like oxygen levels, blood pressure, heart rate. If everything looks good and it's safe to proceed, then we proceed. First thing I do, I put a small IV in. Again, I'm an anesthesiologist, so I've done thousands. It's a very minor procedure. And then once everything's good to go, there's different journeys people go on, so I'll go over that. But some patients like complete silence. They bring a blindfold or music, and that's their chance to meditate. And what they say, it's very interesting, is they almost feel like an outer body experiment or like a third person watching themselves. So they're actually able to restructure their thinking and think as an outsider, not the usual negative self-talk that they have.
Yes.
So that's very helpful for those patients. Some actually, I've had their family members sit with them, and either they talk or they're just there to provide comfort. And I've actually sat with my patients as well. Some of them just tell me their life stories, which is great, or I'll just hold their hand. So it's really personal preference, but they describe it as this warm feeling, this feeling of calm. They know that they're awake. They're not in a sedated, well, they are in a sedated state, but they're not unconscious. So they're aware that something's different, but they just feel relaxed, and this is different from their normal state of anxiety, depression, and negativity.
Yes, indeed. And how long does a session normally take or typically take? And I know that may depend on each particular person, his or her situation, but in general terms.
So actually, all mental health is 1 to 1.5 hours. So the total infusion time is 40 minutes. And minimum, I like to keep the patient for 20 minutes to observe vital signs, make sure they're safe to go. And they always have to go home with a designated driver for safety. If I did pain, that's very complicated. That's a 4-hour infusion and then 1 to 2 hours of recovery. Most centers would do an hour, 40 minutes of the treatment and 20 minutes of recovery.
Okay, that's certainly good to know as well. And you mentioned pain, so for folks dealing with chronic pain or acute pain conditions that also tried some of the more traditional options and didn't get the results they needed, where the pain continued, ketamine therapy is also a wonderful option to help them as well.
Oh, it's excellent, but it's much more complicated. Again, you want to go to a center where they have the expertise. Because it's a higher dose, it's a longer infusion, and it's 4 to 6 hours.
All right. Now, the next question I know also depends on each particular patient of yours, and everyone's different. We may have the same condition or conditions, but we're not all the same, certainly. So I wanted to ask you if you could be kind enough as well, Dr. Stephanie, to just give us an idea of how many therapy sessions are typically necessary to help your particular patients.
So for the mental health protocols that I use, you always want to do 6 treatments up front to get it loaded onto the patient. So those can occur over 2 or 3 weeks. So I'll either do 2 treatments per week for 3 weeks or 3 treatments a week for 2 weeks. And I don't want them back to back because I want the brain plasticity to occur, which takes a little bit of time. Once that's occurred, some patients don't come back for several months once they start feeling symptoms again, and some come back monthly. Again, it's patient specific based on physiology, but I like to keep on top of it. As soon as they feel a little bit like they're not themselves in terms of the positive way, we start treatment. And at that point, it's not 6 treatments, it's usually just 1. So 1 a month maybe.
Okay, moving forward after that initial,
Correct.
more
Intensive,
frequent. Yes.
right, yes.
Okay. Now, what type of results can your patients expect? And I want to put in the proper disclaimer there as well. It all depends, I'm sure, on each particular person, his or her situation, how long they've had this condition, the level that they of extreme possibly that some of these folks have been dealing with these conditions. But generally speaking as well, what type of results are your patients seeing?
Yeah, so for the mental health conditions, it's actually 70 to 80% get relief from the therapy, so they do very well. And for pain, it can last up to 3 months, the results.
Those are some very impressive
They
results.
are, yeah. That's why it's so big everywhere else. You
Yes,
know?
well, with you here educating the DMV community, I'm sure a lot of folks are going to realize what a great option ketamine therapy is for them as well who are dealing with these issues.
Yes, absolutely.
Now, how quickly do patients typically begin seeing results? And again, I know that depends on each person as well.
Right, so I've had patients feel results right away. They leave and they feel excellent. That's not typically the norm. I would say after the 3rd out of 6 infusions, I would say the majority do have their benefits after the 3rd treatment.
I also wanted to ask you, Dr. Stephanie, what other health issues can be treated with ketamine therapy beyond the mental health issues? And I know you touched on chronic and extreme pain-related issues as well. Is there anything else that ketamine therapy can help folks with?
No, but again, I think the main one is pain. It's very complicated, and CPRS is a condition that fails many, many treatments, and there are patients that say this has literally saved their lives. They couldn't get out of bed, and now they have a whole new lease on life, and they go for this treatment specifically because it's the only one that's worked.
We're literally out of time, but I wanted to ask you before I let you go, you and your practice have certainly established a reputation for excellence in this region. You're helping so many folks dealing with a number of severe and chronic conditions and mental health as well as pain. I just wanted to ask you what you feel really helps separate you and your practice apart from many of the others.
Well, like I said, I've been practicing for about 15 years. I've been an educator, and so safety, comfort, patient care is my priority. So I'm more like a boutique, unique practice in the fact that I am the person greeting you and I'm the person sending you home. I am it. And I will not compromise. I want it to be an individualized experience. I've spoken to patients that say they go in, they get the IV, they leave. It's almost like an assembly line. This is very different. It's in an amazing location. And I've had the results, I have the experience, and I know that it works and I can help a lot of people.
Yes, indeed. I love your location in McLean,
Thank you.
Virginia. You are centrally located indeed
Yeah.
for folks not only throughout Northern Virginia, but DC and Maryland as well.
Yeah.
And I also love the fact that when patients come to you, it's you who they're going to be dealing with.
Yes.
You're on a consistent basis.
Absolutely.
And that one-on-one approach has certainly resulted in such a high level of patient satisfaction with you and the experiences that so many folks are benefiting from by coming to you. So on that note, I'd like to thank you, Dr. Stephanie,
Thank you.
for joining us, educating us, and being a guest on our program. It was our pleasure having you on.
Thank you so much. It was great.